It's bright. It's bright. It's really bright. Now, before I started, I wanted to share something funny with you guys. So as most of you probably did when Vice President Biden was here, you took your phone out and sneaked a picture and sent it to someone. I plead guilty. I sent it to my wife and 3 children. So my wife and I always argue about, is it genetic or environment? Of course, when the kids do something well, it comes from my side, and when it's something bad, it's her side, and then sometimes we agree it's from neither. So we kind of are split on genetic environment. So I sent the pic to my wife and children. So my wife sends a text back, "Wow, great pic, what an incredible experience." My daughter, who's in NYU in theater, said, "Handsome guy." My middle son's at Notre Dame getting a master's in business innovation. He said, "Cool podium." And then my oldest, my son's in intelligence at Langley, said, "Tell Joe hi." So anyway, I thought, we're going to send that to them. I'll share with you what they say with my picture. So anyway, I'm Jim DeFontis. I'm an executive medical director for Kaiser Permanente for the Southern California region, and I'm responsible for our patient safety and our perioperative services. So a little PR here. We in Southern California currently have 14 medical centers and provide care to over 4.2 million patients, and it's from San Diego to Ventura. Our national program's much larger. We cover 10.6 million patients, and it's kind of exciting. We have 664 facilities, over 8,000 physicians, 51,000 nurses, and 194,000 employees. It's getting bigger. We're very proud. Washington just turned into one of our facilities. That was just announced last week. Southern California is responsible for about 40% of our overall care delivery. So it's my privilege today to be announcing our commitment to reduce preventable deaths and save lives at this 2017 summit. Our commitment is to reduce the number of unnecessary red blood cell transfusions across our Southern California KP enterprise. We started this journey in 2014, shortly after I attended this summit, in which the recommendation came out for restricting blood management practice across the country. I thought it was an excellent summit, and the breakouts, you had breakouts at that time, and it was really fascinating. So we've embarked on a patient blood management program which encompasses 3 standard clinical pillars. The first is to apply evidence-based medical and surgical approaches to manage anemia and blood loss. The second is to optimize hemostasis preoperatively. And the third is to minimize blood loss and transfusion post-op. Since 2015, we have effectively eliminated all 3 of our autologous blood centers. Now, most of that was probably from the total joint surgeons not recognizing they didn't need to do autologous blood draws because of the Paul-Gann Act, which we mistakenly understood you had to offer everybody. You do have to offer it, but you don't have to encourage it. So we were able to shut down 3 centers. Today, on average, pre-transfusion, the patient's average hemoglobin is 7.4 gram %. After a transfusion, typically it's 8.5, and per episode, we're giving 1.1 transfusion per patient, which we're very proud of. It really comes from Joe and your group. We have an ongoing goal of reducing our transfusions 5 to 15% annually until we have achieved an overall 85% reduction in our red blood cell transfusions. As you know, estimated lives saved and harm prevented is very difficult to assess. However, the literature is clear that increased morbidity and mortality is associated with patients receiving transfusions. And we could go into that. There's lots of interesting literature around that. 60-70% increase in morbidity and mortality, chance of recurrence of cancer, primary cancer, increased length of stay. It just goes on and goes on. So we're proud to be decreasing this unnecessary risk to our patients and our staff. And we applaud Joe and this movement for shining the light on this opportunity to improve patient safety. Thank you.